Government Support by Christopher Bowie, Tim Ponciano, and Camille Morris. Department of Health and Human Services is misusing their money. The motto, improving the health and safety and well-being of America. That is the motto of Department of Health and Human Services. They were once known as Department of Education and Welfare. This program was first proposed by President Harding in 1923. However, it was not officially enacted until about 30 years later. The United States Department of Health and Human Services is a cabinet-level department of the United States government enlisting the goal of protecting the health of all Americans as well as providing essential human services. As a newly found program, controversy surrounded HHS. However, the Department of Health and Human Services often reinvented itself and became one of the most powerful forces in the United States. Enlisting many programs under its wings, the United States Department of Health and Human Services helps out those in need of financial aid when it comes to health and basic human necessities. First broken down at the federal level, HHS is one of the most valued programs in the U.S. Rightfully so, HHS is funded by the government. $27 billion a year is its income. Despite the substantial expansion of work, the support programs, they fall far short of fulfilling the needs of low-income working families. The complexity of program rules, lack of information, asset tests, and stigma, however, inhibit many families' participation in these support programs. In addition, child care funds fall short of demand in most states, and the expanded subsidy program has challenged states' administrative capacity and families' ability to understand the program. From the federal level, the system then breaks down to each state, making the state responsible for their own citizens. In California, the vision of which HHS is based is that all Californians, especially those most at risk or in need, have the opportunity to enjoy a high quality of life as measured by the sound physically and mentally and financially. Children should be healthy. Adolescents and adults, strong and well-functioning families, safe and sustainable communities, and dignity for all. In Nevada, the same bases are given, but which they come at a different approach. Programs such as Family Ties of Nevada help the system function and those in need to see another day. Initially, our stance was that the government support program, HHS, was not up to par with the other programs the country has to offer. However, as we conduct our research, statistics have proven that the government is generally careful as to where they spend their money in human services. In this case, the government is trying to become better, not build itself up to be good. So we ask, is the government efficiently using their money to improve the lives of poor and low-income families?